Good morning, good afternoon, everyone. Thank you for joining our webinar, Smart Modernization, a dynamic approach to digital IT transformation and data integration. Before we begin, I'd like to point out that all lines will be muted for the duration of the webinar. However, questions are encouraged and will be answered at the end of the presentation. Please submit all your questions in the chat box on the top right of your screen. We have 4 polling questions at different intervals in our presentation. Please take a moment to take the poll. Our session has been recorded today and will provide you a link to the recording within a day. And with that, I'm happy to introduce our speakers. John Kelly. John is Principal Advisor at Edifecs. John provides strategic consulting to Edifecs customers, specializing in information exchange and applying the principles of supply chain integration to the healthcare delivery lifecycle. John is nationally recognized health information exchange expert and currently serves as a VD board member. Our second presenter today is Joshua Jahani. Joshua is a senior manager with Edifecs Operation Consulting Practice. Prior to joining Edifecs, Joshua worked in Cognizant Business Consulting and Deloitte Consulting's health practice. Joshua brings many years of experience across numerous industries with a very specific focus in healthcare. His skills include detailed healthcare system analysis, healthcare business strategy, developing IT infrastructure, and end-to-end project implementation. Welcome, John and Joshua. Now I'd like to request John to start the presentation.
Thank you, Riz, and thank you to all of you who took the valuable time out of your day here to listen to some thoughts and ideas we have on smart modernization. I think we can take a look at the agenda. I'll cover quickly what we hope to cover today. First, talking about, are you ready for the changes? I think you think about change all the time in your organizations, I'm sure, as we all do. And there may be some information we can share to help you focus a little more on exactly what that means to be ready. We're also going to then propose what we call a smart approach to modernization, a practice and a view on what to do with the money that you have to spend anyway to spend it in a smart way. Then my colleague Joshua will discuss some case studies and then go through some ideas we have for how you can build the business case and actually do an exercise to show a hard ROI. Then we'll summarize and answer some questions. So, are you ready for changes? Let me talk first about this slide is not just what a lot of vendors might portray as a self-serving commercial about why we're so brilliant, but what this slide is meant to do is to convey to you that I'm going to share some opinions today and why Edifecs has the grounding or the background to actually be telling you something that's worth listening to. We have, in the words of a famous movie, acquired a certain set of skills over a long period of time. We have been laser focused on the healthcare industry and specifically on moving information between payers and providers for 20 years. And so we, in responding to our customers' needs, have developed software and methods and perspectives that we think is pretty deep, and we hope that you think we have something to say about how to spend some of your healthcare dollars when you're looking at your infrastructure and trying to make the world of information exchange with your trading partners. So what is affecting, what's different about today and change? Next slide, Jonathan. Joshua. So on the left-hand side here, we all know we're moving from a pay-for-service or pay-for-volume world to a pay-for-value, and I think you've probably seen this type of a matrix or a slide in a lot of different presentations by many people, both within your organization, without. I think the one part, if you look to the bottom, a perspective that we want to add to this kind of slide is, what is the goal of automating in this move from pay-for-service to pay-for-value? Pay-for-service, pay-for-value is really about information exchange between you and a lot more trading partners. The world's getting more complex, your contracts are getting more complex, and at the end of the day, if you're getting a lot of phone calls about the journey you're making from pay to service to pay for value, or reports of things going wrong, information not getting there, where you want to be is in a place where you're not getting a lot of phone calls, but that you've got a high level of transparency available to everybody to see how the process is working, where the successes are, and how to troubleshoot any failures and the breakdowns in the process. And the reason why that's so important, if you look to the right side of the slide, is if you think about what's happening in your organization today and the industry at large, we started really automating the administrative practices using the HIPAA transactions. So, the types of transactions back in 2000 was somewhat limited. The volume of those transactions that we were moving was also somewhat limited. The number of trading partners that you were trading with. In some cases, people were dealing with a single trading partner or clearinghouse that was fronting their organization to the rest of the world. Now, if you look at where you are, fast forward to 2017, 2016, the number of transactions you're doing has gone through the roof, or will shortly go through the roof if you haven't gotten there yet, with moving from first the claims in the X12 to the simple ADTs and eligibility and enrollment, to now considering claims attachment, HICS enrollment, retail healthcare, now trying to deal with the emerging data that will probably come online in the next 18 months with the FHIR standards, and then getting to comprehensive data education where you're working with a community of providers and payers and public sector agencies all sharing information. So you have a rapid increase in the types of information, the number of people you're trading that information with, the volume of the information, and the speed with which it's being generated. So, we're really looking at, to probably overuse a phrase, a tsunami of data that's about to come online and about to hit your doorsteps over the next few years. And the whole notion of pay for value is predicated on the idea that you can actually do something with that information, so that you're really looking at what you're spending on healthcare, how you're delivering healthcare, and what kind of outcomes you're getting for the dollars spent. So in general in the industry, what we're trying to do with value is if you pay it for a dollar's worth of care, you want to make sure you get a dollar's worth of care back, and ideally more than what you're paying for. Next slide. So I'm going to go a little deeper into what I was talking about in that last, in terms of, take it down a step. What is really driving this volume of information and the kinds of things you're doing with it? If you think about a patient moving through the system, an oncology patient that comes and first gets diagnosed, say, for example, they make their appointment, there's information generated, there's an eligibility check, a couple of things that go on, then maybe a referral, then they see their PCP, then they start generating all kinds of labs, x-rays, imaging services, then procedures, or they might have, say bone problems with the cancer, and then they see an orthopedic surgeon outside of the oncology episode of care. They're in and out of the hospital, they're consuming a huge number of pharmacy drugs, they may need physical therapy or treatment after for any of the procedures they've undergone, and then they're back in their PCP, and they're probably going to repeat the cycle, unfortunately, over a period of 1, 2, 5, 10 years. And while they're moving through the system, generating all these messages, ORUs, ADTs, CCDs, CDAs, and all of the claims data, the attachments, the eligibilities, the REF-auths, you're trying to take that data and quickly spin up programs to worry about things like lab steerage or network steerage, or duplicate lab avoidance programs, pain management programs, trying to coordinate risk assumed by ACOs. You're trying to provide more engagement, more information through your patient portal. And in general, you're trying to avoid breakdowns in the process like pending claims and appeals and everything else. We're beyond the notion of simplification or administrative simplification. We're into the world of delivery automation. You want to automate all of those administrative transactions. We want to automate the sharing and the proliferation of information. So this is going to require an infrastructure that supports that. And if you think about what you've done in another part of your life with your smartphone, you have largely automated these kind of things. If you want to share, you can connect directly with thousands of people. Your contact list, probably, if you're like most professionals, has at least 500 to 1,000 contacts, direct connections you're managing right off of a device in your hand. You can send films, you can send music, you can send PDFs, you can send just about any kind of format you want. And when it gets to the other person, their device can open it up. It understands what kind of payload it is, and then it opens the right kind of software so that you can have the right interaction. You can forward through messaging, you can forward through email. All that automation exists in technology, and we're now trying to bring that into healthcare. But if you think about the 20 years or so that it's taken the cell phone to get there, and we're trying to do this very quickly in a matter of 5 to 10 years, that's what's creating this tsunami. That's what's creating the volume issue. So that's where we are right now, and that's the kind of thing, those are the kind of things you need to think about in terms of whether you're ready for change. Next slide. So let me look a little more at that data and how it's being represented probably in your world today. You know, you have a significant volume of administrative data that you've got administrative systems for. You've got a lot more volume on your financial data that's existing in that world, probably in another silo. And then, of course, you've got all the clinical information that you're starting to amass. Some of it's now on paper. A lot of it's spread over multiple systems or combined in your data warehouse. But it's growing exponentially, and unfortunately, in most cases that we see with our customers, it's in silos, it's in separate systems, and it is not really available across the board. It causes all kinds of inefficiencies, redundancies, and in a sense, you know, we hear about data blocking between EMRs. We've actually, I think, you know, what I see, and we're experiencing data blocking even within our own internal organizations. You know, not that anyone's trying to hoard the data, but it's just unreachable. And when you think about it, you've got all these different systems that are spread across, but you've got the data trapped within those applications. So your payment modules don't cross into your clinical information, your HL7 transactions don't come over to your administrative, your standards and your compliance data sets don't cross you know, all the columns. And you've really got a situation where we have internal disinteroperability. And it's dysfunctional, and most importantly, it doesn't let you correlate your insights. You have people in your organization with insights in clinical, people in your organization with insights in financial, and people who are running the day-to-day back and forth traffic between you and all your trading partners. And there's a lot of insight to be had within those silos, but the ability to unleash those insights, cross-correlate them across your organization, that's what's going to give you the ability to deal with the change that you have to face right now. Next, Josh. So what the idea would be to rip apart those silos, get all of your data into a consolidated engine. Now you've got a data warehouse, but you've got a lot of data in motion. So the idea is to try to consolidate how that data is moving in. So in real time, it can be cross-correlated across all of your domains, whether it be administrative, financial, or clinical. Next slide, Josh. So let's look at this in terms of what you're tasked to do. You all have budgets, you all have projects, you're all participating in some kind of queuing for the 2017 budget. Some of you may have locked it down, but my guess is, in my experience, that you're still wrestling with each other, trying to see, you know, what money is available and what programs you're going to do. And you've got the stuff you have to do. If you've got legacy systems that have to be replaced, end-of-life systems, or stuff that just isn't working, or you just went through a merger or an acquisition, and you've got multiple systems in multiple places, you have no choice. You've got to consolidate. So you've got budget pretty much for that nuts and bolts stuff. Compliance, again, you know, if you have to do it, you have to do it. So you've probably done a pretty good job of going to the CIO or the CFO or whoever and saying, okay, I need this much money to do my compliance requirements. Now you get into, how am I dealing with this transition to value-based care? So I've got new programs and new digital services and new engagement. Well, the gap between all of the great ideas and innovation that you have in your organization and what you've got available to spend next year starts to widen. And then when you get into you know, the real opportunities to shave money off your MLR and really start to save money on utilization, those are expensive projects that have a lot to do with data and data management and data movement and insight that you just don't, there's a big gap. There's not enough money to budget all of this stuff at the same time. So right now you're wrestling internally with, how do you get done everything you need to get done and stay underneath that budget line? Next slide, Josh. So here we're going to stop and take a survey question.
Hello, everyone. Let's take the first question here. So the question is, what would you select as your biggest HIT challenge? Your responses are: implement new apps for the VBC, remediating and upgrading current systems, reducing resources or IT budget, all of the above? Please take a moment to respond. All right, we'll give another 10 seconds or so. Okay. I see a few responses coming in. Okay, we'll close the poll for the first question. And let's see here. So 44% of you responded on the second choice, remediating and upgrading current system. So, and then the 22% and all of the above, which is 33%. Go ahead, John.
Sure. So that's interesting because if you think about the shift toward value-based care, what virtually all of you just said was that you really can't focus on that right now. You know, your biggest opportunity to grow your top line and reduce your bottom line is a place that most of you have responded you're not investing in because you have to remediate your upgrade your current systems that are just not up to the task of doing the enrollment and the intake and the processing of the business you're doing right now, so it's hard to even think about what you're going to go doing down the road. And also you're living in a world where margins are closing, so you're reducing your resources, your IT budget. So what we're suggesting is there's a smart approach to spending that money that you need to modernize, and if there's a way that you can spend $1 and get $2 worth of value, or buy one get one free, or kill two birds with one stone, whatever metaphor you want to use, it seems like that would make sense to look at. So I'm going to start talking about how you might try to look at what you're spending and what you're doing and think about it using a smart approach. Now, typically, and especially on that response of modernizing systems, there's a number of approaches that organizations take that we see with our customers. And there's adding applications. So, you know, it's quick and dirty. You have your CFO, your CMO, your CEO, whoever, they go out and spend a day golfing with an IT vendor, they come back and now you have 3 projects, you know, one for provider network, one for the claim system, one for pop health that you got to implement. It's going to solve all those problems that they say they're going to solve, and you're going to get fast deployment because you're going to run these projects in parallel, and you're going to be a little bit of expense associated with it, but this is your strategy, this is your approach. I'm going to just buy an application to solve my problem. So you get flexibility, you get fast deployment, but you exacerbate the problem of data silos. You don't get the cross-correlation and limited visibility, and frequently you have a lot of redundant data spread across multiple systems. So a second approach that we see a lot of people taking is what I'll call the data warehouse approach, or consolidate and distribute. So basically saying a lot of my problems are related to information. I have the right information at the right time in the right place. I can solve all my headaches. So you look at all your systems, you develop a fairly substantial infrastructure for moving all of the data in the back end into the data warehouse, where you get people to churn it and spin it and process it and analyze it and correlate it, and then you push it back out. So you get decent data reliability, but you do end up with latency. You can't necessarily respond as quickly as you want to respond, both with new ideas, innovations, or even with things like clinical alerts and intervening at points of care in a timely fashion. The other thing is that you go into it and it's a long effort to develop the data model to support all of these questions you want to ask. And then if your paradigm changes, or your contracting model changes, or you develop a whole new set of products to hit, say, the retail healthcare market, then a lot of times your data model hasn't been designed around what you're going to do tomorrow. So now, and then it's not easy to change your data model, and your time to market on a lot of new innovation gets slowed down significantly. Then another approach that you see a lot of right now, especially on the payer side, people have grown up with large monolithic core systems that they're using to do as much as they can. You know, it kind of promotes the idea of a single source of data. So you go out and you buy a whole bunch of new modules, you know, or a whole bunch of modules for your claim system for network management, or your CRM system to be able to do care management and continuity of care programs and relationships to build stickiness between providers and payers and I mean between members and payers and members and providers. And then you put in a whole new provider management system module that will help you manage all these tight networks and the high performance networks and the micro networks that are associated with many of the new products that are coming out, especially on Exchange. And that can work well in an existing environment, but it's a very costly upgrade exercise. There's a tremendous amount of testing, especially regression testing, that has to be done. These projects usually take a long time, 1 to 2 years in many cases, to take your core system and add in all the new modules and update everybody and train everybody. And then basically you're locked into the pathway that your vendor for that core system has decided they want to go based on where they're going to sell the most products in the marketplace. So again, another solution that has some pros but certainly has some cons. And then another thing that we see a lot now is they look at the first three and they go, huge headache, how about I just outsource it? So you take all your problems, you find the right person to outsource it to, and you then kind of wash your hands of all the headaches and the problems. You figure out a PMPM cost, you figure out that that works okay with your premiums that you're going to have next year. But what do you have? You're outsourcing to someone who's a commodity broker, essentially. You're never going to be any better than your competition. The context of the data kind of gets normalized and because everybody's got different data in their back end, so when they push it to the outsourcer, it all has to fit into the outsourcer's data model. And you don't get a lot of the internal workflow optimization that you would like because you're basically stuck with, whatever applications they have developed for the general market. So again, you got 4 approaches here. Everybody generally picks one of them and moves forward, and they do the best they can. And no one gets it 100% right, but everybody gets the job done to the degree they can at a fixed cost. Next slide. So another polling question that we want to offer?
Sure. So the second polling question is, I will launch that right now. What approach below would best describe your current modernization projects? 4 choices here are yes, actively engage in project, yes, within the last 6 months, yes, over 6 months, and the last response is no, not my responsibility. Please take a moment to respond. All right. There is an equal response on 1 and 2. Okay. Second is the winner so far. We'll give another 5 or 10 seconds more. All right, so I see the responses trickling down a little bit. Okay, so we'll close that. Okay, anybody else? Okay, I will close this. So there is a tie between the first answer and the second answer, 43%, and then followed by the third response here, 14%. John?
Okay, thanks. So suffice it to say, you're all engaged in these modernization projects, so hopefully the perspective we're giving you is going to add some value. Yeah, thank you. So let me shift topics for just a second here to give you a sense of when we talk about a smart approach to modernization in your enterprise, what's one of the key components that is critical for healthcare to start taking advantage of kind of the world of technology we have today. So if you think about credit card fraud, they have adopted a process that frequently is called on-the-wire processing. And if you think about credit card fraud a number of years ago, the only way you were managing it was by seeing your report, your credit card report once a month, taking a look at it and thinking to yourself, geez, I didn't buy that, and then making a phone call and having to go through a lot of process. So then we fast forward a little where the credit card agencies realized that there's something they could do about this. They developed algorithms and they looked at their database and they started identifying cases that might be fraudulent. And so what did they do? They said, okay, we're going to help the consumer. We are going to freeze the card if we see any problems. So you're standing at the counter, you give them your card, and it's declined, and you say try it again, and it continues to be declined, and and then you have to call later when you get home after you use another card, and they say, oh yeah, right, we saw this, and you go, well, thank you very much, but it really was me, and they go, okay, we'll take the freeze off your card. Now to come fast forward to 2016, the state of the process is the data is moving through the wire, each transaction in real time. First transaction they look at, they go, that looks a little funky. Second transaction, they go, okay, keep an eye on this. Third transaction, they go, that's it, freeze the card. But rather than having you inconvenienced when you go to use that card, you get a message on your cell phone that says, geez, we just noticed this might not be you. Is it you or not? And then you answer yes or no, and then they unfree the card, and you tell the person behind the counter, yep, go ahead and try it again, and it flies through. So what you have here is this processing on the wire where you have one event, two events, three events, and then suddenly a trigger goes off, and then an intervention occurs, and then you are able to engage in the intervention and then get a good outcome. This is all done in an automated way in real time, not waiting for anything to go into a data warehouse, not waiting for anybody to do an analysis, but watching the accumulation of events over time and being able to respond to that and being able to give choices to people. So this is really, if you think about it, not unlike what we are attempting to do in a lot of cases with things like clinical alerts or fraudulent claims. With fraudulent claims, a lot of times you have to pay the claim and then you find out months later and then you're chasing, whereas if you could be watching behavior of a particular provider or a particular patient at a given time, you might actually be able to pick things up much more closer and be able to intervene before that claim gets set to pay. So this is a very important functionality. If you want to do things in a smart way, you want to think about building into your systems as you modernize. If you invest in modernization without having this kind of on-the-wire processing capability, or what we like to call smart pipes, you've missed a huge opportunity. Next slide. So let's think about your pipes in your organization. Every one of you out there has a capability to take information in from your various trading partners, from your payers, from your members, from your employer groups, customers, whoever, government organizations, bring them in, move them into your downstream systems, however they need to be moved, format them into the format they need to go, and then be able to process them in the back end in your systems. But if you think about that pipe and you can upgrade it to a smart pipe, while that data is coming through, you can be simplifying the consolidation. You can be correlating clinical data and administrative data at the same time. You can see an eligibility check that correlates with a referral off, that correlates maybe with a visit or an emergency room visit that's correlating with an ADT message that's coming in from the hospital. And you can do this in real time in a smart pipe the same way the credit agencies look at each transaction as it occurs. And so not only can you move the information down through the pipe, down to your backend systems and do everything that you need to do based on what you're doing today, you can also be providing metrics and transparency and interventions and identifying risks in real time and pushing that information back out to your stakeholders and your partners and your consumers in order to achieve results that are consistent with this move toward value-based care. Next slide. So just to give you an idea, when I say smart pipes, it's not just some voodoo word that we're throwing out there, and what is happening in those credit card pipes that are different than yours. Inside the smart pipes, you've got your ED gateway in the front end, EDI gateway in the front end, or your clinical gateway that's connecting to your external partners. You've got your pipes on the back end that connect to your core systems and your population health databases and whatnot. But in the middle, a smart pipe doesn't do just validation and sorting and simple mapping. It applies rules, it translates things, it routes to core systems, it tracks and traces and keeps track of every single thing. I mean, think about a air traffic control or FedEx tracking, and combine that with the way Amazon does picking and packing and pulls in stuff from multiple vendors and puts it all in one box and sends it to you. It does all of that mechanical stuff. Then at the same time, it's actually tied into services and logic and applications that can do the correlation, can identify things, can apply rules, and trigger interventions in real time and push them out. And those messages can go internally, they can go external, they can be auto notifications. That's what's happening in a smart pipe. And that's what we're advocating is kind of at the core of the SMART approach. Next slide. So you've got that delivery budget, you've got these projects, you've got these gaps, you've got an idea that maybe you can get $2 value for $1 spent. So if you think about the SMART approach that we're talking about is you're going to spend a certain amount of money anyway at that budget. Why not spend it in a way strategically that gets you more value out of the same money spent, that introduces the notion of smart pipes and a smart approach to modernization that doesn't necessarily get pushed into your backend system, doesn't complicate your current operations, leverages your internal architecture as it is, but adds a layer of capacity up front at the edge of the enterprise that allows you to get more for less. Next slide, Josh. So in kind of summary of this concept of the smart pipes and it's more for less, you need to expect more from your IT project.
We lost John for a moment. Yeah, go ahead.
I'm sorry. Yeah, and need to expect more from what you're spending. And so whether it's your legacy replacement, not just customized integration efforts, but protect your investments and expand on them. On compliance, create compliance that doesn't just meet last year's OR, but you're anticipating next year's operating rules or meaningful use changes. And in a system that can deal with compliance for clinical as well as compliance for pharmacy and administrative X12 transactions at the same time. Also, start leveraging the smart pipes so that not just adding channels and resources for new lines of business, but adding them in a way that you're putting the functionality and building it right into the development of those programs. Sharing data in any system in real time and also being able to push interventions, things like that. And then just being able to have a much better handle in more near real time or in some cases real time about what's happening with your risk. You have a patient that comes in and there's an encounter and it's just a visit and it's a physical. And so, okay, no big deal on the risk. Then you get a blood test result. Then you get a radiology result. Now you get 3 things. That should trigger. You shouldn't need to wait till the first quarter or the first half or perhaps even the end of the year to look back on your population and your claims utilization or your clinical data to say, wow, this was the risk I had on that patient. You want to be able to tell doctors in your risk groups right away that, you know what, I've just tracked 3 encounters on this patient and I can't be certain, but keep an eye on them. I think there may be a problem here. There's lots of anecdotes and use cases where there's enough data available to predict an outcome or a patient event 6 months to a year before it actually occurs if people are looking at the right stuff at the right time and applying the right algorithms. So that's the idea of the SMART approach, is to actually look at your projects, look at your selections, don't just fall back on what you've done before, but expect more from the process of modernizing your infrastructure. So with that, I'm going to turn it over to Josh, and he's going to give you a couple of case studies. Now, the case studies are that we're going to present to you are where people absolutely had to spend money because they were end-of-life situations. But even if these case studies aren't completely on point to what you're doing, the idea is you're going to spend money to modernize your infrastructure at some point. Think about doing it in a smart way.
Thanks, John. That was a very good overview of the smart modernization approach. And as John mentioned, what we're going to talk about now is some very specific examples of how you can tactically modernize your operations and your technology if you're in a end-of-life or a situation needing modernization. The 3 examples we're going to talk about today are going to be Sybase, JCAPs, and Biztalk related. And the importance of talking about in the beginning is that some of you, potentially all of you, may have received end-of-life notices informing you about specific modernization updates that might need to be made. So we'll pause here for a survey question. Siriz?
Yeah, sure. Thanks, John. Joshua. Here's our third question. So your question is, do you hold data and conduct error resolution before it lands in your core system? Your choices are yes, we have reduced bad data significantly. Second response is somewhat, some automation, but mostly manual. Third response could be better, still have challenges. Fourth is no, this is creating business issues. Please take a moment to respond. We have some responses coming in. Okay, all right, a few more. All right, a few more. Okay, we'll close the poll. And the results are 67% chose the third choice, could be better, still have challenges. Joshua?
Okay, thanks, Riz. So that's good. So that actually is perfectly in line with where we see a lot of our customers and our clients land based on our experience today. And we're going to use that information to help springboard into this discussion of these success stories. So as we talk about Biztalk and we talk about Sybase, one of the important things to remember about these particular instances was that in the Biztalk environment, the case study that we're using today, the customer was spending hours on the phone, opening IT tickets, trying to track down information in different fragmented systems and spreadsheets throughout their enterprise and the organization. But with a modernization approach and with the Edifecs solution in this instance, they were able to save their time and really only invest about 5 minutes because of all of that smart wire processing Mr. John Kelly was talking about in terms of the ability to get the real-time transaction information and the instantaneous visibility for both IT and the business operations teams. We'll talk a little bit about ROI in a second, but that gets into the ROI framework that we use. On the Sybase side, we had a Medicaid customer who was dealing with a lot of issues around the timeliness of their claims information. And what Edifecs was able to help them do was not only improve the visibility and the basic administrative simplifications areas, but also sort of in that clean claims metric that was so core to their operations and their business, and help them sustain it over the long term. And if someone is not speaking, I would ask them to go on mute, please. I'm getting some background noise. Don't think it's coming from me. Some of the important things we want to highlight about these three specific case studies, even though if you are in a situation where you need modernization and it might not be JCAPs, Biztalk, or Sybase related, that item that John Kelly spoke about with how you spend $1 but you get $2 of value, Edifecs is always able to modernize and replace features for our health plan clients because of our specific focus in healthcare. And a lot of times this has to do with sort of modernizing the exception and correction work queues, enabling, like I said, the IT and the business resources, but then delving in deeper to those specific transactions and those specific use cases that might be driving some pain points on the technology or the business side. In the Biztalk case, there was a lot of need around the remittance device and the A35s, and the ability to gain visibility into managing and communicating the status of that with providers or submitters was essential for handling payment timeliness and remaining compliant. Additionally, rich standard support and deep validation, if you can see this matrix at the bottom, which you'll see for each of these three case studies, was something that was very valuable to the customer in this case because they were features that they weren't able to take advantage of at the moment, and they had a very large IT TCO to implement these things sort of on the fly, but with a smart modernization approach, they were able to automate and include these kinds of features out of the box. The JCAPs example is a really excellent example of a Southwest health plan that's very large. And in this case, a very specific end-of-life situation, the health plan needed to essentially figure out a way to manage its entire claims infrastructure and orchestration. In the case of this particular JCAPs environment, there were over 100 different interfaces throughout the health plan that all needed to be brought into a consolidated platform. And as you can imagine, by modernizing in those features, the health plan was able to experience some really intense ROI metrics and business benefits. This was largely related to reduction in time and costs for relating support calls for different kinds of providers, also allowing key business and operations resources to focus on more important items and not chase down information throughout the enterprise. The utilization of a common claims front end also enhanced the analytics initiatives in the department. So if you remember John Kelly when he was talking about those different initiatives and how that green smart modernization pyramid sort of climbs up, those specific improvements that might be beyond a necessarily end-of-life replacement were extremely valuable. And then for Sybase, what I really want to drive home here is the active industry participation and the complete trading partner management. So John actually gave a really good example of how you have your iPhone or you have an Android phone and you have hundreds of contacts and they can be sending you information at any time of day. It's the same case that we see for your enterprises and for our customers, is the ability to manage these partners, to set up specific rules and relationships so that when they send you information, you know exactly what to do with it given the specifics of the situation, is very valuable for making sure that you are providing the best kind of service you can to your internal partners as well as your end customers, the members. So now, after talking about these case studies, we're going to delve a little bit into the business case. So at Edifecs, we're constantly innovating and we're constantly trying to drive change for how we can provide better service to our customers. And one of the things that we're offering, and that's part of this webinar and what we'll get into right now, is how we partner with our customers in specific instances to build a business case. We have generated some pretty powerful ROI analyses for clients all over the nation. We recently had a glowing recommendation from the CIO of a very large Northwestern health plan who used the information to articulate her business case to her CFO. And we're very proud that we've been able to really come up with such an intelligent approach that it can be read and pitched and discussed at the C-level and the C-suite internally, so that we're really enabling our champions and our partners to do their jobs very, very well and to modernize. The way our business case works and the way we've structured it is we define drivers, and these drivers are specific use cases for how a modernization initiative will enhance value. So it can be reduced costs by perhaps leveraging, in some cases, it's as simple as snip edits. In other cases, it has to do with a much more intelligent UI. And then we take those drivers, we assign assumptions to them, and then we're able to calculate a very compelling ROI. What's important about this and these kinds of assessments to note is that we take the modernization approach very, very seriously in all of the business cases we develop. Hosting and things like being able to put things in the cloud is very important to us. We're actually going through a business case right now with a very large Western health plan, and we're showing some very significant ROI and streamlined operations by sort of consolidating their hosted infrastructure. In addition, with the traditional sort of modernization value propositions, we're able to find and elicit value that the client or the customer in some cases isn't always immediately aware of. And because we've done this for so many different health plans, we're able to bring those best practices perspective. It's all based on current and future state analysis, which is a very essential part of the framework and the point of view we bring to these engagements. So we did this survey question, and I saw John sent a note. So in this case, it was number 3, could be better and still have challenges.
Yes.
And the importance,
go ahead, Joshua.
The importance of this result and the relevance of this survey is that it directly affects the kind of business case drivers we are always highlighting. The modernization approach that Mr. John Kelly was talking about and the ability to put this processing power and this intelligence on the wire tied to having the ability to make sure that the data you're receiving and the data that you're passing around internally is the most valuable. So with an understanding of that, and when we partner with our clients and our customers, here are some sample ROI drivers I've included, and we talked about the model just a few slides ago. But we're able to generate very articulate and tailor-made ROI drivers that are specific for our customer situation. And then by generating assumptions and conducting some calculations, we're able to produce an ROI model. These are always driven by assessment discovery. So during the introductions, Riz was talking about this, and we have a lot of this expertise within Edifecs. I come from a consulting background, and so being able to elicit this information through a rapid discovery type assessment and not something that would interrupt our customers' day-to-day operations, because we know you all are very busy, and we appreciate the time you take all the time. Being able to generate the kind of information that we need with very specific questionnaires that we have tailored to different modernization scenarios or use cases is something that we have, and something that we always use to drive the discovery of this information. We focus on a holistic approach as much as possible. Obviously, we're interested in getting the work that our customers need done as rapidly as possible. So oftentimes we might not focus on something like analytics if the modernization project happens to be an infrastructure. But given the instance where it might be, depending on the champions that we have and the business partners that we have, we tailor-make that approach. We wanted to include a few screenshots of our ROI calculator. We're very proud of it, and the reason we've included it here is because we always share the model after an engagement. So we're very happy to be as transparent as possible and to really partner and sort of roll up our sleeves and get to work side by side with our partners and generate these kinds of models so that everyone is enabled and aware of what's happening in our ROI calculation. The numbers included in this have been obfuscated, but they are from an example. And what we're able to do is show cumulative savings year over year, and then the difference, of course, from this blue line and this orange line over, in this case, it looks like about 5 years, becomes money cumulatively that you could have spent on something else, again, based on this ROI model and these drivers.
Joshua, do you want to interject 1 second here? The point about Joshua said about sharing the model is very critical, because what we have found is when our internal champion takes that model to other places, sometimes the assumptions get questioned, sometimes the dollars associated with cost savings get questioned, and the beauty of the model is that if there are internal questions and you suggest a different value internally, you can pump that into the model and see what effect it has, and then you can have, kind of an objective, reasoned discussion to validate the ROI. And that has, on the financial side and for the financial folks in the organization, we found that was received very well.
Yeah, that's a really good point, John. Thank you. And then being able to also educate our partners and our customers on what the best practice drivers may be based on our experience of doing it so many times, and the fact that we have people like John Kelly we can leverage is very valuable. So in terms of building the business case, we are offering this over the next 30 days based on availability of key resources, and something that we wanted to make sure and bring to everyone's attention during the webinar. But we do conduct these risk and gap assessments that can help you build your ROI. Our experts have done these gap assessments and impact studies like we've been talking about hundreds and hundreds of times. It's a one-day assessment. We do it as rapidly as possible to minimize the impact to your operations. And then because of tight schedules, we are offering this for the next 30 days. And like John said as well, the spreadsheet, education of the spreadsheet, walking you through how it works, that's something that we do offer. And it looks like we have a survey question.
Yep. So, guys, sorry about the previous questions. That was a little bit reversed, but this question is the correct question. Your question is, do you typically include an ROI assessment with your business case to support funding request for an IT modernization project? Your choices are yes, it's always mandatory. Yes, sometimes it depends on the budget. No, it has not been a requirement in the past. Please take a moment to respond. Okay, have some responses coming in. The winner so far is the choice 1. And let's give a couple more seconds. All right, I think we have another time for this question here. Okay, we'll close the polls and show the results. So there's a tie between 1 and 2, 40% each, and then the third one is 20%. Joshua?
Thanks, Riz. Thank you. And that is what we've seen. In the case of these ROI assessments, depending on the scenario and the use case for modernization and the significance of the investment, it's usually some level between yes, always, or yes, sometimes. We haven't seen in the last 10 years, really, it being no very often because of the kinds of innovations that are being made in healthcare, and again, based on our vantage point in the industry as well, which is why we're very proud and we've worked very hard to develop this kind of proven C-suite ready model for our partners. Thanks for that, Liz. And in summary, what's really important as the 3 key takeaways from today's webinar, and John did such a great job outlining this, but that smart modernization, more with less, being able to spend $1 and receive $2 of value by modernizing your technology and your systems, which affect the IT teams and the business teams and teams all across the enterprise. Edifecs comes with a 20-year history of being extremely healthcare focused. We're laser focused in healthcare. We work very hard to innovate and to provide value in healthcare, something that we're very proud of. We're not afraid of tackling clinical integration challenges for VBC, as well as all the new compliance regulations that come out. We spend a lot of time and energy making sure we're completely on top of that. And then that smart approach, being able to comply with mandates of reporting and business visibility, that's key for enhancing your competitive advantage in the way that you do business. And then reducing service engagement costs with experienced professionals and out-of-the-box capability. This ability to replace features, modernize features, and then get that additional value like we talked about in the case studies. So with that, I'll leave it to Riz if we have any questions.
Yeah, we have a few questions and we'll try to answer them in the remaining time. If we cannot get to it, we'll respond you via email. The first question is, you mentioned the idea of smart pipes. How are your customer using smart pipes? Josh,
So I'll take a shot at that.
Sure.
So one of the more recent requests we've done, which is pretty interesting, we've done a proof of concept for a plan in the Northeast. They're having a problem with fraudulent reports of change of life events. So someone's mid-cycle of the enrollment year, they get sick, and then they basically say, lost my job, got married, had a baby, whatever. And they report that, they get added, and then they find months later that the event was fraudulent. Well, the claims have already been paid, the money's out the door. The chances of chasing that member for that, or taking them to court for fraudulent behaviors, isn't going to fix anything on the bottom line. So a lot of times it's just lost money. What we have been working with a couple of partner organizations like LexisNexis is to be able to, as transactions come in the door, parse them, send them out to a partner who does specific kinds of services, and then bring that back in and create a report. So in this case, LexisNexis is a group that probably knows more about us than the NSA, certainly, and they can look at things like past events and history and records on the patient, and then respond with a service that says, you know what, this one is someone you ought to look at. It's not a definite, it's not a yes, they're breaking the law or anything like that. It's just, you know what, they said they lost their job, but I'm still seeing weekly deposits in their bank account or whatever. So that kind of service is probably one of the more sophisticated, coolest examples of smart pipes that we've been working on. Other simple ones are just being able to look for dupes in claims as they're coming in real time, doing claims edits, doing eligibility checks. CAQH has this service called COB Smart, where you can ping them and see if there's other COB. So we've got the capability to integrate with COB Smart, so when the claims come in, we can do an eligibility check immediately and check and see if there's a possibility of third-party insurance or COB on that claim. So it's really about, we're already moving information in and out of the system and looking for tags or rules that our customer gives us and finds them. We've got some more sophisticated prototypes that we've done for a product we have called Population Dimensions, which has a component called Intervention Gateway that's actually looking for lab results on patients as they're coming in, where a payer has got contracts where they're getting ADTs and lab result orders from a couple of provider partners who are highly aligned, and being able to look for those and have that contribute to either risk measurement or analytics. So there's a host of these, and I mean, we'd be certainly, if you are interested in that in particular, I think there's going to be opportunities after this for you to follow up with us, and we'll be happy to elaborate with some of our more detailed case studies.
John, we have, John and Joshua, we have another question here. We have a couple more minutes so we can take this. How does your ROI model work in terms of timelines, deliverables, and arrangements?
Well, Josh, I'll leave that to you.
Thanks, John. Yeah, so that's a really good question. The ROI model that we've developed over the last few years has been focused on being rapid, like we talked about, so it has a minimal impact to the production of the key resources at our customer sites. We usually conduct the analysis over 1 or 2 days with pretty minimal prep. We're very specific in terms of the information we ask for, the kinds of metrics that we look for to be able to articulate that ROI and business case. The arrangement is a case-by-case basis. Sometimes it's paid, sometimes it's not paid. It really depends on what the scope of the deliverables are. If it's simply a business case, we usually try to provide that as quickly as possible to our customers. If our customers want to take advantage of the business advisory services that we do offer and that we can't deliver, then that conversation sort of goes down that line. So we customize it.
All right, we have another minute if you can handle this. Can you talk more about your case studies and EOL customers? How did the value added go beyond and standard replacement?
Sure, I'll take that one as well. So the case studies, really to sum it up, I think what the real take-home message has been for a lot of the end-of-life case studies, between the examples we gave as well as other examples related to Gentran and things, is exactly what John Kelly was talking about in terms of being able to not only provide the processing power, the kind of nuts and bolts, nitty-gritty work that's done on a day-to-day basis, whether it be in Biztalk, Sybase, Gentran, JCAPs, whatever it is, but then also to provide the kind of visibility to resources and players across the enterprise as well as partners. So in the case that you might have a submitter or a partner want to do more collaborative testing, those kinds of visibilities and that kind of engagement to really bring everyone to the same point at the table and enhance that business value has been very essential.
All right.
I'll just add, I think that the key thing there, what differentiates a lot of these systems we're replacing, you can certainly provide some of this functionality by doing custom projects and configurations and writing your own Java services and stuff. The point of us being in healthcare for 20 years is that a lot of the stuff that you would have to do as custom work in those other applications already comes built in the box. So when you replace that system with ours, there's a whole bunch of things you can now do, like the smart pipes, that would have been customization or a lot of investment on your part if you had the original, replace the other system with one like it.
Good. We are right on top of the hour here. Thank you everyone for joining today's presentation. We appreciate your participation. We wish you all a great day and much success with digital IT transformation initiatives. Thank you.